Good morning, good afternoon, good evening, everyone. Thank you for joining us today. I am under Nogueira, and I'm going to be the chair of this session. I'm very excited about the work that is going to be presented here. I am an associate researcher and instructor for the School of Public Health in Harvard, bringing design to the science of public health. So it's quite interesting how we see several efforts at that interdisciplinary space related to expanding questions that our silo body of knowledge have been able to develop. So this is my invitation to you all. As you are seeing the presentations today, I invite you to stay tuned to the types of questions that people are asking, the meaning behind them, and if they are questions that are of single domain. I think that's quite interesting of the nature of the work that you see today. So today, there'll be two main presentations related to water infrastructure and equity, and in the context of COVID. So the focus is not particularly COVID, but it's actually rather it's looking at COVID as a disruptive context to then explore one of the fundamental challenges that we have in the 21st century, which relates to water infrastructure. So the first presentation will be given by Lauryn, Khalid, and Nikki. I'm going to introduce them in a minute. And the second presentation will be given by Catherine. We have approximately 75 minutes in the session. So our agenda will be 40 minutes of this first presentation with 3 speakers, and then 10 minutes for the second presentation. Then we're gonna have a short panel discussion between them based on their presentation, and then Q&A from the audience. So let me introduce you to the 3 of them that you see up here. So Nikki, there she is. Nikki is a PhD student in Engineering and Public Policy Department at Carnegie Mellon University. With a background in civil systems engineering and having worked for the World Bank, she's passionate about understanding how physical infrastructure perpetuates aspects of inequity in low-income area within the United States and developing context. Her current research is focused on modeling and assessing how physical infrastructure systems and the policies pertaining them have further exacerbated existing inequities, especially in the light of the pandemic. So welcome, Nikki. Laurel Spearing is a National Science Foundation Graduate Research Fellow pursuing her PhD in Civil Engineering at the University of Texas at Austin. She is passionate about improving people's quality of life by increasing the level of service received from infrastructure and ensuring access to critical infrastructure systems. Her research interests include studying the human interaction with the built environment and infrastructure system management under population dynamics uncertainty. Welcome. And Leslie, originally from Portland, Khalid Osman is a PhD candidate in civil engineering at the University of Texas at Austin. Khalid is a Ford Foundation pre-doctoral fellow and a Gates Millennium Scholar. His passion for civil engineering derives from his commitment to help people as the world faces clear challenges in dealing with the crumbling and non-existent infrastructure and increasing inequities in levels of services provided to our communities. Khalid's past works span public perception towards water infrastructure, the assessment of water conservation efforts, and the management of existing infrastructure systems to meet the needs of those being served. His research interests around the operationalization of equity in water sector infrastructure, water affordability, and stakeholder community engagement for sustainable civil infrastructure systems for the future. So I'll let you all enjoy their presentation, and I'll be back in a minute.
Well, thank you very much, Andre, for the introductions, and thanks to everyone for being here. We're excited to share our work with you. We've already had introductions of our team, but as we kind of talked about, we're going to be presenting on water and the COVID within the COVID systems, and we have 3 different kind of presentations of how these come together in terms of current work that we've done. If we go to the next slide, we've got kind of an overview of how these different kind of presentations fit together. So the first study that we'll share with you is more of an overview of equity in terms of how it fits within the water systems and reliability of water systems. The second presentation, Lauryn will share with us the impacts of COVID on water utilities. The third, Khalid will share with us how communications around water and within the time of crisis happens. And then I'll wrap us up with a presentation of how water moratoriums under the scenario of COVID might help bridge some of the gaps that we see in equity. So I'll be starting the discussion on what we mean about water systems and equity in terms of the bigger picture here. Perfect. So let's begin by thinking about what we mean when we talk about water systems. There are so many different uses of water and the ways that we interact with our water systems. And when we think about the way that people interact and use water systems, we're reminded that water systems aren't just a technical system. Water infrastructure is a socio-technical system, meaning that there's a design of these systems that should consider a human, social, and organizational factors in addition to technical factors. So in the next few slides, I'd like to lay the groundwork for the importance of equity in the current state of water equity within the United States itself, and how our work interrelates with that in addressing this issue. So if we think back to the early 1900s, we find that typhoid fever and deaths amongst African American communities were related to poor water quality. In 1948, the Federal Water Pollution Control Act was the first major US law to address water pollution. This law wasn't enacted because African American communities were suffering, but rather because downstream white communities were struggling with effluent from upstream African American communities. Growing public awareness and concern for controlling water pollution led to sweeping amendments in 1972 with the Clean Water Act. Then in 1974, the Safe Drinking Water Act was signed into law to regulate drinking water in the US and to create investments for connecting the drinking water systems. However, those investments weren't equitably distributed, leading some Black communities to be denied access to centralized systems. For example, what we've seen fairly recently is the Clint water crisis. And another example that we're currently dealing with is COVID and how access to water systems and infrastructure impact people's equitable access to services, and what that means for long-term health, which we'll see in a couple slides' time. Next slide. So our collaborative team has thought about the topic of water provision and equity from 2 lenses throughout the duration of our work. The first is quality, and the second is quantity. And we like to think about how these impact communities during times of crisis, such as COVID. So this chart here shows the number of health-based violations in community water systems that the United States has had, where we see new rules are introduced. And as these new rules are introduced, we see that more violations occur. And this is an interesting thing to note, and it's not necessarily a fault of the water utilities, but the Safe Drinking Water Act and the Clean Water Act don't provide adequate resources for community water systems to address this quality issue. And as we know, there's a tight coupling between water and public health. However, there are also built-in inequities, which not only impact individuals, but entire communities. And so we're now seeing this in the time of the pandemic. There's a cascading impact of poor water quality that extends beyond individual households. So for example, if you're sick, if you're sick from poor water access or poor water quality and you can't go to work, for poor families, missing a day of work can be critical, especially during times of COVID when having work and a source of income so important. So in addition to water quality, water quantity has also been an issue, especially during COVID. And this has been of utmost concern during COVID because people have been struggling to pay their water utility bills. We'll see in a future presentation to what extent this reaches, but intermittent supply and complete water shutoffs have been more critical during COVID than perhaps before. In 2016, water utilities reported that there was approximately 15 million US residents who had to pay their water, who had their water shut off due to a lack of being able to pay. And the average water utility reported about 5% shutoffs due to non-payment. We're using 2016 data here because there's a challenge around the data that's tracked in this. And so you'll see some of our later work is in around the qualitative data collection and figuring out how we can use data that we have access to. But under COVID, the Census Bureau reported that more than 80 million Americans are having difficulty paying their utility bills during COVID. So as I mentioned previously, water is directly coupled with health. And we think about water's relationship with health during COVID, this becomes even more essential to consider. We do see that leaders recognize the importance of access to water. In a later presentation, we'll see that about 35 out of the 50 states in the US have implemented a mandatory water shutoff moratorium, which we'll go into further detail then. And several others have implemented voluntary shutoffs. So this is to say that understanding water is important in terms of understanding how washing our hands helps us to stay healthy, and how understanding this shouldn't be limited just to context of pandemic, but in general, how water systems perpetuate situations of inequity. Next slide, Khalid, thanks. So in addition to the specific health-related impacts of having improper quality and quantity of water throughout COVID, the pandemic also impacted the operations of water utilities, which impacted their ability to provide reliable services in an equitable manner. So Lauryn will cover this in her presentation, which is coming up next. But COVID has impacted water utilities from various different concerns, including at a workforce level of ensuring operators are able to work, at a supply chain and ensuring all equipment was accessible for water quality testing and how to manage limited staff, community-related aspects, including communication challenges, and that communication challenge is what Khalid will elaborate on further. So I'll now hand it over to Lauryn, who will explain to us in more detail the implications of COVID for water utilities and what it means for reliability of quality of water. And then Khalid will further explain the equity implications of communication strategies around these services.
Awesome, thanks, Nikki. So yeah, as Nikki said, I'm going to talk a little bit about the impacts that COVID had on water utilities in the US. So a lot of changes occurred during social distancing policies, right? We all saw them, but they also impacted water utilities. So social distancing policies led to workforce changes, right? Having to implement these policies and keep their employees safe. It also led to demand change. People were using water differently. Maybe they were using it at different times or in different locations. Then we also saw things like late payments, right? You know, COVID came with an economic crisis, and this really led to some equity issues of people being able to actually afford to pay their water bills. And so this also led to things like moratoriums being enacted, which is what Nikki is going to expand a lot on at the end of today. So what this first objective that I'm going to talk about is really just trying to understand how water utilities continue to provide reliable water services during COVID. So specifically, we looked at two research objectives. First, we wanted to just know, what challenges were present? What challenges did utilities face? And what system changes happened? Then we also just wanted to document, how did utilities respond to the pandemic? So in order to do this, we performed semi-structured interviews with utilities throughout the US. And so we talked to 28 utilities in 13 different states, which just mapped to the right shows the different states we talked to people in. And this actually included insight from over 50 employees. And then we took this data and we did a qualitative analysis. So when I say qualitative analysis, we basically just did qualitative coding of these interviews. And so we identified themes in qualitative data by coding phrases. And so a code here is just a word or a phrase that assigns an essence capturing attribute to a piece of text. And this really allows us to just abstract and understand uncertain systems and circumstances like COVID. And then we can also make more objective conclusions by aiming to remove as much bias as we can. So what did we find? Overwhelmingly, a lot of planning and management challenges. And so I'm going to use a lot of figures like this when I talk today, so I want to walk through this one for a second. What this is showing is just a percent of responding utilities that either experienced a challenge, which is shown in blue, or did not, which is shown in orange. And anything in gray in these figures is really just that a utility didn't know or they didn't mention it when we were talking to them. But first, I want to jump into personnel management challenges. And as you can see in this figure, 75% of utilities mention this, right? And actually no utilities said that they didn't experience personnel management challenges. So, so I want to draw your attention to the quote at the bottom of the screen because I think it says it pretty well. It says, "We quickly realized it was a labor management administrative nightmare," right? It was a lot. All of a sudden, these utilities are trying to enact social distancing policies and make sure they're continuing to provide water services that are safe and efficient. And so there was a lot of administrative work for managers. And additionally, one of the kind of system vulnerabilities we saw here was this really kind of need for operators to be able to work, mostly at smaller utilities, when maybe there's only one or two operators. So if one or both of these individuals got sick, right, it's a big vulnerability to the system. We also saw an increase in early retirements in the data. And so, as a lot of reports have shown, right, the water workforce has been aging, and a lot of people have been retiring out without kind of getting replacement from younger populations. And so we see that COVID's probably going to make this existing issue worse. And in response to kind of these workforce challenges, utilities did things like split staff into shifts or had standby crews. They additionally made operation facilities restricted access. And again, this was to protect their operators. And then they did things like vehicle policies, maybe getting a little creative with rental vehicles or allowing field employees to use their own personal vehicle, for instance. Additionally, there was a lot of supply chain issues, which these were widespread, right, throughout industries. But within the water sector, there were challenges for PPE and routine supplies. So a lot of utilities just suddenly had to really increase their planning to ensure that their supply chain was reliable. And this involved both kind of routine supplies like chemicals, for instance, and then also these new supplies, right? Personal protective equipment that they probably didn't have on hand. And so in response to these challenges, utilities ordered extra materials if they could, and they also became priority customers. So they called their supplier, say for chlorine, and said, "We are an essential service, right? We are a public health service, so we need to be prioritized to get this chemical if there is a shortage or any supply chain issue there." They also got a little creative, making PPE in-house. Some of them used their labs to make hand sanitizer and shared it throughout the city as well. So some utilities talked about how they made hand sanitizer and handed it out to the police department and fire department. So a lot of collaboration there. And lastly, there were some international supply chain issues as well. And I want to note that we conducted these interviews about a year ago, so last summer. And so it was pretty early on in the pandemic. And so the quote at the bottom talks about how they just hadn't received some specialty valves from Italy. And I'm going to talk a little bit about changes in demand and revenue, which I think is one of the most interesting findings from this study. If you look at the figure to the right, you see that a lot of, can you go back one, Khalid? You're revealing all my surprises. But if you look at the top bar here, anything in green is an increase in demand. So utilities that actually saw an increase, and anything in purple is a decrease. And then in blue, you can see that a lot of utilities actually said they didn't have an overall demand change, and they attributed that to a shift. So there was a commercial and industrial reduction in use, but it was paired with an increase in residential demand. So overall, they actually didn't see a big change. But some utilities did, right? And we really saw that it was dependent on customer composition here. So the utilities that saw an increase were maybe residential areas, maybe a suburb. So people are actually staying in the service area instead of going to work. And so they were getting kind of a bump in demand paired with a bump in revenue sometimes. We also saw that there was a noticeable revenue change at utilities. And this bottom bar doesn't match the top bar. And a lot of that is because of an increase in delinquent accounts. And so almost half, right, 46% of the utilities we talked to did see an increase in late payments or delinquent accounts from their customers, which impacts their revenue, as well as it obviously impacts users as well. We also saw, lastly, some demand patterns were changed as well. So not only did overall demand change sometimes, but when people were using demand changed. So the quote at the bottom talks about how kind of every day looked like the weekend now, which makes sense if you think about it, right? Maybe we all started sleeping in a little later because we didn't have to commute, and showering a little bit later in the day, for instance. And additionally, things like college towns, we talked to a couple utilities that were based in college towns, and they compared it to winter break or summer break. And then I want to point out kind of the implications of the revenue change that we're seeing at these utilities. So this actually led utilities to have to postpone capital projects and sometimes even non-critical maintenance, which is really important to note as it really impacts system resiliency. And we're likely going to see some of these impacts going forward, right? If we weren't investing in our aging infrastructure during COVID, we're going to see this kind of made worse in the future, possibly. In terms of water quality, we really saw a lot of resiliency. So majority of utilities said, no, we really didn't notice disinfectant residual changes or water quality challenges. Again, this was at the beginning of the pandemic, so a lot of utilities hadn't had the time to really dive in and investigate kind of maybe small changes in residuals. Most of the challenges they did mention were tied to testing and supply chain issues again. So maybe issues coordinating with the labs or getting lab materials. And then in response, utilities had to change testing locations away from households to public spaces, and then some delayed some non-regulatory testing. Then in terms of the community, a lot of utilities noticed an increase in customer complaints. Most of this was really early in the pandemic, and it was people just asking, is my water safe to drink, right? Can I get sick from my water? And so in response, they had to increase a lot of outreach of, hey, your water is safe, right? Like everything is okay here. And they also increased outreach about flushing protocols, especially kind of communicating, you know, if your commercial building has been shut down for a while, you need to flush your premise plumbing before bringing people back in. Then we also saw some changes to customer service. So a lot of utilities went completely remote, but some mentioned that they had drive-throughs. And it was kind of an equity issue here, right? Some people did not have internet access during COVID, and so they needed to provide a way for these people to pay their bill. They did it through a drive-through. And then lastly, I want to take a second to just kind of note one of the benefits of social distancing we saw here. Utilities over and over said that customers were just more aware of their water system. They were curious and asking questions, and it's kind of an educational opportunity there. And then lastly, for kind of the key takeaway here and connecting to what Khalid and Nikki are going to talk about later, I want to ask, you know, what does this mean for equity in water systems? And so as Nikki mentioned earlier, there's existing issues, right? In 2016, about 15 million residents in the US had their water shut off. And then we look at COVID and we see an increase in delinquent accounts and enrollment in customer assistance programs. And this is paired with this historic lack of investment in water infrastructure systems that we've been seeing. And again, during COVID, we see a decrease in financial capacity from utilities, leading to delayed projects. And this is also kind of limiting utilities' ability to make investments, equitable investments in infrastructure. And again, it could really make these equity issues worse during the pandemic and after. And so it really reveals a research need to study equity issues in the water sector and how to utilize our resources effectively, mostly during crises and kind of uncertain operating contexts like COVID. Then I just want to take a second to acknowledge this funding for this project was the NSF Rapid Grant, and then the participating utilities and municipalities, and then all the faculty and students from UT Austin and the University of Washington that worked on this. And this is published in ES&T Water, and I'll put that DOI in the chat in case anybody wants to read a little bit more about this, and I'm also happy to answer questions during the panel. Great, and then I'll pass it over to Khalid.
Thank you, Lauryn. Great presentation, especially when you're talking about utilities having resource constraints, I think that leads right into what I want to talk about a little bit, and how to most effectively use those resources that we have. And so just thinking back to how our work fits together, on the second project I'll be talking about crisis communication, and we're looking at the pandemic as a sort of a proxy for a crisis. And one thing that Lauryn mentioned is that, people are more aware of their water systems as a result of the pandemic. And this is also shown by, the AWWA publishing this recently. They're sending out a report to utilities on how best to communicate with their constituents or their end users. And so, because the public is really paying more attention to authoritative sources during a crisis, effective communication is even more important than during normal life. And so the AWWA, American Water Works Association, presents the following framework for utilities to mirror, where messaging should focus on being empathetic, factual, and transparent. And during major disasters, online social media platforms are becoming more prevalent for effective information dissemination. And recent studies actually suggest that social media plays an important role in crisis communications. And there's very reasons for this. As Lauryn mentioned, sometimes folks don't have access to internet or power. And so using your mobile phone gives you access to real-time data. And then social media monitoring is actually used by a lot of emergency management organizations. However, research does show that in diverse communities, oftentimes residents don't feel prepared in disaster situations. And a lot of this has to do with the fact that they're seeking information and messaging that's sensitive to them. However, the messaging is not being dispersed to them in ways that they'll understand best. And so some of the research questions as part of this study there's 4 of them. The first one is, are water utilities employing effective external crisis communications during a disaster? How are water utilities contributing to the conversation nationally during a protracted crisis? Does social media outreach help customer engagement for water utilities during disaster? And then are there equity implications with regards to water utility communications during a protracted crisis? And so to examine this question of whether water utilities are achieving equitable crisis communications, we use COVID-19 as a proxy for a protracted crisis. Specifically, we use hotspots throughout the country, areas where there are critical need during this time, to really gauge the sentiment of utility tweets and also some of the topics that they're tweeting out. And so for the data collection here, what we had is over 180,000 tweets that we used from water utilities in 338 hotspot counties across the US. And so if you look at the chart here, you'll see areas that are darker red are areas of high critical need during this time. And so to be considered a hotspot, you had to have 100 or more new COVID-19 cases in 7 days, and then an increase in the next 7 days, and a ratio of your 7 to 30 day that is over 0.31, which is determined by the CDC. And so these tweets were extracted from county utility profiles directly for the time period from January 30th of 2020 until January 30th of 2021, giving us a full 52 weeks. And so we started on January 30th because that was the day that the World Health Organization had declared COVID-19 a worldwide pandemic. And so I show this heat map here just to show that utilities are participating in the conversation. So here's an example from the southern region. So this is not the whole US, but just the southern region of the US, showing that COVID-19 really dominated utility conversations. It was one of the most frequently occurring words here throughout the entire time. And here I wanted to show that COVID-19, and so we conducted a bigram analysis for all of the counties just within Texas. And what we found was that COVID-19 was sort of a hub. It had the most connection in all of the bigrams. And we can see here that it's almost connected to everything that the utilities were talking about during this 52-week period. And so we gauged for sentiment here as well. And so what we see here is that when we incorporate the trend line, that most of the utilities are following what the AWWA had listed out, that messaging should be empathetic, it should be direct, And we see here that with regards to subjectivity, it's mostly neutral, less opinionated. And how the model accounts for subjectivity is looking at I statements, our statements, or my statements, for example. And the polarity is skewed a little towards positive. However, as we can see from the R-squared value, there is some variability in there. But just from looking at the chart, it looks like there is a little bit of a positivity skew. And so in order to identify some patterns in the tweets, so not just looking at word frequencies and sentiment, but actually identifying what the tweets are saying, we use the topic modeling algorithm to categorize the different patterns into topics. And so just briefly stated, topic modeling looks for words that co-occur in documents at higher rates than expected if the words are distributed randomly. And so for our documents, quote unquote, for us is our tweets. And so words that have a relatively high co-occurrence are typically grouped together into topics, with each topic represented as a weighted distribution over all the unique words within that document or tweet. And then the content of each topic is related to the top weighted words per topic. And so our top 10 topics, so we measured this for 10 topics, 100 topics, 1,000 topics. And what we found was that 10 gave us the best fit model. And our top 10 topics are shown here, but there's two that I want to focus on. The first one is COVID topics containing Spanish words, because we only did this for Texas. That actually was one of the most frequently occurring topics that came up. And then the other one was utility water assistance. So tweets related to utility water assistance. One thing I do want to note here is that, you know, COVID topics containing Spanish words being the #1 topic doesn't necessarily mean that these were the most tweets that were going out. All it means is that the words occur together most frequently. And so this is actually pretty typical, because in English words that occur together are plenty, but within the tweets, it's pretty rare to find Spanish words that are occurring together. And so that's why we found that those were the most paired words, uniquely paired words. And so what I wanted to show here with the next 3 charts is really focused on the #1 topic and the #7 topic that I've shown here. And so here we see that, you know, a lot of counties are tweeting information. However, in areas where there's high Hispanic populations, high Hispanic Latinx communities, they're not really receiving the communications in Spanish. We can see topic 1 is pretty sparse throughout this chart. And we see that the correlation is actually not that high. And then here, when we look at areas of high poverty, we see the same thing, where topics related to financial assistance are not that frequent. And then there's actually a negative correlation between the two. And so for folks who don't know what SVI is, it's the Social Vulnerability Index. It's a measure that the CDC created to look at folks who are especially at risk during public health emergencies because of factors like socioeconomic status, household composition, minority status, housing type, or having access to transportation. And what we see here is that there's another negative correlation between tweets that involve financial assistance from utilities and areas that have very high SVIs. And so this brings me back to the point that I had previously mentioned, that in diverse communities, residents often do not really feel prepared in disaster situations. And a part of this has to do with the communications that they're receiving not being sensitive to them or what they would understand. And so some of the contributions and takeaways from this study, first one is that water utilities are using the pandemic as an opportunity to raise awareness around the critical services that they provide. However, there are equity implications with regards to water utility communications during a protracted crisis. One thing is that social media communication is very one-way, and current methods that utilities use for communicating with residents is very resource intensive. And so social media can provide an opportunity for utilities to solve some of their resource constraints with regards to communication. However, doing it in an effective and equitable manner is necessary. And then the last one would be to create some effective two-way communications, similar to what a lot of companies do via Twitter DMs. And so I'm going to pitch it off to Nikki to talk about the last part of our study, which are moratoriums. Please take it away, Nikki.
Thanks, Khalid. Thanks. It's that aspect of communication so important when we think about connecting Lauryn's topic of the utilities and impacts of COVID on utilities to how then users interface with that. And I kind of bridge that gap by thinking about how policies pertaining to moratoriums interact with all that. Okay. So when we think about, yeah, we can go to the next slide, thanks. When we think about CDC's list of 5 important ways to slow the spread, their list of rules includes 1, get a vaccine, 2, wear a mask, 3, keep 6 feet of distance from other people, 4, avoid crowds, and 5, wash your hands often. So we've all been told about the importance of hand washing in light of COVID era and how keeping clean hands and sanitation helps improve health. However, in light of our previous presentations and some of the background we shared with you, we're interested in understanding how inequities present in water systems already might impact transmission of COVID and how COVID might make some of those inequities worse. So a study recently conducted by the AWWA found that water utilities have had a 6% increase on average across the US in customers that paid delinquent water bills. So under a normal circumstance, a delinquent bill might mean loss of water services, which in turn makes it really challenging to wash your hands, which, as we know now and all are familiar with, has been really important in light of COVID. If you want to, thanks. So given the financial challenges of COVID presented, some states did take action to implement water moratoriums, which we'll cover in the future. But I first wanted to give you a little more context. So the main map here shows the water withdrawals in millions of gallons per day from public utilities. It's kind of hard to contextualize in terms of scale. I don't know how many gallons of water I drink a day. It's probably less than a gallon. So it's helpful to know that most water, so 88% of water, is provided by publicly owned utilities in the United States. And so there are different types of publicly owned utilities. These can range from community water systems to non-transient, non-community water systems and transient non-community water systems. So the main one that we usually think of when we think of a publicly owned utility system is a community water system, which supplies water to the same population year-round. Given that such a large majority of the population relies on public water sources, we're interested in understanding how government responded to the water provision crisis that resulted when people weren't able to pay their bills as a result of COVID. So for clarity's sake, let's first define what water moratoriums, what we're meaning when we say that. So when we say water moratoriums, we're thinking of a temporary halt on disconnecting a household's water, regardless of a delinquent water bill. So water utilities have to keep people connected to that water service, even if they haven't been able to pay. There has been some federal assistance that have been made available to individuals to cover the gaps, but it's important to note that it was made to individuals and not at a federal or state level. And so see, these are some of the examples. So the Low-Income Household Water Assistance Program provided $638 million to help consumers pay water debts. Similarly, the Emergency Rental and Utility Assistance it allowed individuals from state and local governments to help elect to use these funds to help cover the paying their utility bills. However, the support was all aimed at the individual level. And we're interested in understanding the policy aspects of what states could do to help support and address some of this inequity that Lauryn and Khalid both touched on. So when we started this work, there was no cohesive data set that had already been collected of this data. So we collected the state utility policies and used a qualitative coding scheme to categorize them thematically. So what Lauryn talked about in terms of her thematic coding approach, similar approach was used here. And it's important to note that not all states implemented a water moratorium. So we see this kind of Venn diagram of some states implemented a water moratorium and some didn't. And so for our purposes, we said that those that implemented a water moratorium, we said that they only implemented a water moratorium, meaning that they implemented it and then it was never lifted. For states that didn't ever implement a water moratorium, we said that they never implemented a water moratorium. And then that sweet spot in the middle, we kind of called it this ever group, meaning that they implemented it at some point and then it was lifted at some point in the future. So when we collected this data, most water moratoriums were implemented in March, and then there were varying degrees of when those were lifted, if they were lifted at all. So this map shows what states implemented and what kinds of water moratoriums were implemented at the state's level. So it's hard to gauge by looking at the different states, but 24 states implemented and then later lifted their water moratoriums, so what we called ever groups. There were 13 states that implemented and have not yet lifted their moratoriums, which means those only groups. And then there were 15 states that never implemented a moratorium. So based off of our qualitative coding scheme, 5 primary policies emerged that were implemented at a state level. The first was the standard moratorium, which was the form of moratorium that we've already described in terms of being a temporary suspension of utilities being able to stop people's access to water. So then there were a series of add-ons that could be used in combination with the standard moratorium. The first was this idea of reconnecting. So the idea that utilities had to reconnect customers that didn't have services or other similar provisions. The second was a payment plan, so in offering a payment plan from the utilities perspective. The third was a plan that allowed for waiving fees, so waiving the reconnection fee to get the service itself reconnected. And then the last was a no fee option. So the utilities didn't charge any kind of late fee or interest with the fee that accrued from having missed a payment. So now that we have a sense of what kind of moratoriums were implemented at a state level, we can start to explore what implications that might have for COVID. So this map here shows what we're looking at is the positivity testing rates of COVID across the United States by state. And if you advance, I think you might have to hit play on the video, Khalid, or advance the slide one more, but it should be, there it is, perfect. So we can see underneath, those are where our moratoriums are implemented. And so this can perhaps initially be a visual or spatial map visual that kind of helps us look at how maybe perhaps positive testing in COVID might have some preliminary association with states that implemented a water moratorium policy. It's really important to note here that these findings and what we're kind of exploring are very initial, very preliminary. There's a lot of work still to be done in terms of looking at COVID as the actual outcome of these results in these scenarios. But in terms of the spatial analysis, we can kind of see that in areas that have high dark red areas, which have high positive test rates, that they also seem to be spatially related to areas that didn't implement moratoriums. So as you said, this work's still very, very much in its initial phases, but in order to kind of show some of these preliminary findings, it's suggested that there might be some association between water moratoriums and COVID cases. So these three plots are showing average from left to right, average testing rates, cases, and then deaths, each separated out by the type of moratorium that we're looking at. And so we can see that the first graph there is related to the map that we just saw. So thinking about how positive testing rates for the never group seems to have a higher overall positive test rate than the nevers and onlys, and that trend does seem to hold across cases and deaths. But it's very preliminary work. So in terms of some of the other preliminary findings we're continuing to explore, in contrast to what we initially thought, trends in urban versus rural areas aren't as clear as we thought that they might be, but it does seem to be clearer in the low income versus high income areas in terms of those discrepancies. And populations with high prevalence of Black and Hispanic people do tend to also to experience some of those inequities that we've been explaining. And further than that, the type of moratorium might matter. So payment plans and waived fees seem to have less impact than no fee and reconnection approaches do, which might suggest that having some kind of stopgap intermediate moratorium approach is not as effective as doing a full out moratorium. So this is still evolving and ongoing work. And so this is just one last slide on this topic that explains how some of this work is potentially connected to some of those areas that we've talked about. So the green shows the mean income at a state level, and the underlying black is, again, those moratoriums. And you can see in this map that they almost switch. So it might suggest that states that have a higher than average mean income might have had the capacity to implement a moratorium. So the impact on COVID cases might not just be solely related to moratoriums, but we might be thinking about some of these other social contexts as well. And so that brings us in full circle of today's presentation. And in order to conclude our portion of the presentation and perhaps kind of kickstart some of the more open forum discussions in addition to the future presentations, we just wanted to leave you with some last thoughts on what the implications of this equitable and reliable services are and how it might be impacted under stressful conditions such as the pandemic. So just a couple of key takeaways. Water infrastructure is a social technical system, and it's important to remember that when we design it and think about policies pertaining to it. Quality and quantity of water provision has been a persistent racial issue throughout time. COVID is perpetuating issues of access, so with more than 80 million Americans having difficulty paying for utilities, inequities and reliability issues present within the system are growing worse as a result of COVID. And communications regarding COVID aren't reaching the right groups that need to hear it. And so now we're exploring how policies pertaining to water systems, including moratoriums, impact COVID and vice versa. And so we want to leave you with some takeaway questions, perhaps for the panel discussion, perhaps just to think about in terms of your own work. But We'd be interested in hearing how future policies ensure better equity and reliability of water-to-water services. How can future crises be better handled to alleviate aspects of inequity? And how do challenges with water infrastructure parallel to other infrastructure systems? So with that, we'll hand it back to Andre with thank yous for hosting us. And please feel free to reach out if you have any questions directly, and we're happy to answer any questions that you might have during the panel as well.
Thank you so much for this presentation. It's quite interesting, the different perspectives of the same issue, right? So looking at this notion of operations, right? And then the organizational level and the challenges within the organization, but then also how the organization is then serving some certain groups and not serving others. Then the notion of that organizational behavior be completely influenced by and conditioned by individuals, right, and human behavior, right? So, and how that became very evident during COVID, and then this challenge of communication and access, right, and understanding language as a potential barrier for understanding issues, but then also, like, if you don't even know the language, or if you're not able to reach the language, let alone what content is meaningful to people, right, and what do they understand, what do they care about, and even the channels, right? I think that there's a huge, a great beginning here in understanding Twitter as a social media channel to access, but then there's so many others, right? Like now TikTok growing, and you have Instagram, and you have YouTube, and you have like, you name it, right? So it's so interesting to explore this different, and then ultimately this notion of the policy, right? The role of policy in this game, not being the only force, but being a potential strong force in terms of providing this. So I think that this is very nice, great work, and leaves us with the question of, out of so many potential intervention areas, which area should we intervene? Right? Is it all of them? Then with what resources, right? So how do we strategize around these things? And I think that there is no quite right answer. And I would like to invite now Catherine to share her work, which I believe it suggests a potential path towards exploring what might be different processes and questions that we might ask as it relates to people, centering around people, which very much is a need if we're dealing with equity in water infrastructure. So Catherine is a designer and researcher who explores the intersection of design and public health through design research and prototyping. She's currently a graduate research assistant at the design laboratory at the Harvard T.H. Chan School of Public Health, and she'll be joining the Penn State University in the College of Information Science and Technology as a PhD student this fall. So thank you, Catherine, and now we'll let you to it.
But thank you, Lauryn, Khalid, and Nikki for that great presentation, and Andre for the introduction. As Andre mentioned, I'm Catherine, and this is part of my graduate work at the IIT Institute of Design. So I don't really need to do much detail now, since the previous presenters did a great job explaining the different ways that communities can face water insecurity, whether that's due to pollutants or high bills. So even in a water-rich community in the Great Lakes, people can still be facing water shutoffs, or like in Flint, high pollutants in the water supply. So I took a look at Chicago in this project, where I previously lived and studied, and here the water infrastructure is considered from an engineering perspective as having a top-of-the-line freshwater filtration system and distribution system, thus providing residents with a consistent, safe drinking water supply. But from these images and to the points that the previous researchers pointed out, we can see that a lot of residents aren't having access to the fresh water supply. And this tends to happen in lower income neighborhoods that comprise of Black and brown residents. And again, both facing both economic and pollution when it comes to the water that's arriving to their home or not arriving to their home. And the current mayor, prior to COVID, actually announced that she was interested in ending water shutoffs with the utility. And while actions like this raise concerns to the pressing issues, they don't answer how we might arrive at more equitable water distribution. So in this project, I took a look at these concerns from a design perspective at the individual level, starting with the observation that infrastructure development continues to utilize policies, processes, and strategies that are really similar to how they were at the beginning of the 19th century. But as we've seen in both presentations today, that these developments, while greatly important, are cutting out certain parts of the population because the development process and upkeep has created such great inequities in communities. So there's a gap between the technical know-how of how to build infrastructure and the lived experiences of individuals. And so we've successfully implemented infrastructure for some, but have struggled to understand the ways in which people use it and or the ways that people have been completely cut out of the system. So a design approach looks at the problem space a little bit differently to understand the human behaviors and their aspirations and what to make in response to those needs and wants. So this diagram is often used in design and is called a 2x2 matrix. And it's a thinking and support tool where you can plot, options or raise questions within the different quadrants. And the one that we're looking at today has an axis that's representing a different state or process, starting at the bottom with what's real. For example, today I ate an apple versus the abstract. I aspire to be healthy. And research, which we're very familiar with, as we just saw some great work in that area, and make. Whatever, buildings, objects, whatever you can make to try to solve a problem. So by using a thinking tool such as this one, designers understand how to consider a problem rather than adapting to a pre-prescribed process, then work through a strategy to understand that issue and establish what to make to address the challenge at hand. And there are 4 key questions to kind of guide us through this process. First, understanding who is it for. If we're looking at a problem like water scarcity, we can probably imagine that maybe starting with Black and Brown communities where they're facing this insecurity every day could be a great place to try to understand what their day-to-day life is like. Why will it create value? Whatever we're making, how does it help those people reach their aspirations to live happy, healthy, prosperous lives? What should I make? In what shape will this intervention that's creating value for people take form? Is it an object, a service, a tool? And finally, how should I make it? Who's going to fund it? Who can I collaborate with? What is the implementation plan? And all of these questions together provide us with the opportunity to develop interventions that fit the daily lives of people rather than fitting into the technical know-how of past intervention development. Not to say that designers want to do away with the technical know-how. We still want our water filtered and vaccines developed by those that have the proper expertise. But my point here is that design provides a perspective to provide alternative ways to view a system and understand the different actors within it and their main aspirations in order to raise new, more targeted questions that help us create interventions that are more likely to successfully integrate into the daily life of people. So with that in mind, my research question was future-oriented. What can we learn about people's daily life today that can help us understand how to develop water infrastructure in the future? So my process for this was first to start with individual experiences, which I invited participants within 8 different communities across, or neighborhoods across Chicago and 2 suburbs to document their interactions with water for a period of 10 days, and then an open interview, discuss why they took that photo and their thoughts and feelings about water in Chicago. And in the initial analysis, I identified a list of unique interactions, 246 in total. And then these interactions were analyzed to identify variables or the key aspects of the interaction with water or the impact on a person or environment, which I'll explain a little bit more in the next slides. And all of these variables were then uploaded into a dynamic mapping software called Kumu to create a collective experiences map. And Kumu was able to identify relationships between the different variables by how often it was mentioned, and ultimately identifying the tensions within the system based on those relationships between the variables. So from here you can see that from emails about water filters to stand-up paddleboarding to, cats stealing your water, people's experiences with water varied greatly, although they were in the same city. And here's an example of what this process looked like. So, a photo was submitted, and this is a brief quote about what that person submitted it. So it's a balloon in the lake, and they chose this photo because it represented the tension between having fun, celebrating a birthday and a convention that we're used to, balloons, and the consequence that it brings to the environment because it pollutes the lake and provides a hazard to other wildlife. And ultimately, the participant picks up the trash after they take the photo. And they say, it's a happy birthday for someone, but it's not a happy situation for the lake, where they're getting polluted with these balloons. So to create variables for this interaction, the entry point was this person visited the lake because it brought them moments of personal joy, which since this experience brought them joy, they developed an amount of respect for non-human life in the environment, which inspired them to have an increase to the willingness to pick up litter or trash, which ultimately created a form of community with a non-human form, which was the lake, that they wanted, because this brought them joy, and they wanted to connect with it and treat it with the same respect that they wanted to be treated with. And so that loop you can see here is part of a larger map, and this is a distilled down version from the entire one with 246 interactions. But as you can see here, there's different drivers and barriers in the system that either inspire people to make change or hinder their ability to make change. And due to the time, I can't add the rich qualitative data to expand on each different tension area, but I'll touch on each of them briefly. So in this gray area, messages of water abundance was in direct contrast with messages of scarcity. So some people felt that they lived to a massive body of water and they could waste as much water as they want. They didn't have to think about it much. In contrast to someone receiving a water test at their home and seeing that they have extremely high levels of lead in their drinking water. And then here in the blue section, technical know-how in contrast to daily use of water. So as I mentioned, Chicago has a really great water filtration system, but many people didn't actually trust that system and continually filtered their water because they had so much distrust in how clean that water was when it arrived to their home. In this orange section, people's aspirations against opportunities to achieve them. So some people were able to build community through water sports like stand-up paddleboarding and wanted to get kids involved as a way to build community to, also pick up trash on the boards and have that kind of connection to the environment, in contrast to some Chicago residents that have never seen the lake. And finally, at the bottom, prioritizing human needs in contrast to maintaining ecosystem integrity. So people have daily rituals or celebration that lead to contamination of our environments, like the balloon in the lake, in contrast to those that really refuse to not buy any plastic bottles because they didn't want that waste ever ending up back in the environment. So the point of doing this kind of exercise was to not get answers, but to raise better questions about what the users were actually interested when it came to water. So one of the areas that, just to stick with this prioritizing human needs to maintaining ecosystem integrity, was raised in a workshop with a small subset of the participants from the primary field work. And we looked at the different contrasts and tried to raise new questions. So in the session, which ended up being a lot of public health folks. So, they were interested in policy change and science education, but we kept coming back to this, we need to respect the water. So from the session, we were able to raise a new question of how might we build opportunities for people to strengthen the relationship to the environment. So what this might look like in a further prototyping phase, in a next step, is we spent a lot of time discussing this public health intervention, which is a lifeguard stand. And it identifies the conditions of the lake, which green means swimming is permitted, yellow, caution's advised, and red, swimming is prohibited. And in 2020, Chicago saw 58 deaths in the lake, which was the highest it's been in many, many years. And people are speculating researchers are speculating it's because this flag was down due to social distancing and the beaches being closed. So due to that, this became like a conversation piece when we were talking about that question, and we are asking ourselves, what if we communicated water safety in a different way that could evoke joy, encourage respect for the planet, and address the complexity of daily life to support both the well-being of people and the Great Lakes. And from that, you could think more specifically to like, what if we were able to create different kinds of access, opportunities to visit the beach, create new opportunities for healthier human to environmental relationships for those that may have never been to the beach? What if we could do something for moms that come to the beach with, 3 kids and a bunch of stuff trying to make it? What if there was a different type of intervention that could make more of a family experience with this type of relation? So yeah, these types of activities raise better questions about what we should be making and why, based on the data that came from the everyday interactions that people were having. And that's it. Thank you so much.
Thank you, Catherine. Quite interesting and complementary work. I think that from the previous perspective, from the previous research done, right? I believe that there is this perspective from this organizational, from this policy level, right, issue, and then from this organizational operations issue. And then, so if we go back to those questions, right, that you were asking on why, how, what, and who, if we think about that why as a more higher level, abstracted policy level, and the how we can look at this operations and organizational level, and the what, if we go on this chain, we can get into Khalid focus, which is on the messaging and the channels that I used, and then the who is it for. Catherine is looking at this diverse activities of daily life and how people actually have different relationships, and how these standard approaches to solutions where tend to be one way, or as Catherine pointed out, and as Nikki pointed out in the beginning as well, this notion of utilizing the same approaches and methods that were initially developed in the 19th century, still the way that we do things, right? And I think that we need to sort of like rethink a little bit the methods and the approaches. We want to think about equity in water infrastructure, particularly with this notion of who needs to adapt, right, in times of crisis. Is it the people that need to adapt to the infrastructure, or is it the system that need to adapt to people? Right, I think that that's so far the rigid and not flexible infrastructures that we have force people to adapt and not to wash their hands and not to drink proper water and etc. because they have these standards defined by primarily what was the economy of scale. So I noticed that we don't have much time left. I think that we had some technical issues with both teams in terms of sharing and presenting that ate a little bit of our time. So I wanted to share just sort of like this want us to focus a little bit or have a conversation on where do you see, I presented a couple of my reflections here, but where do you see this overlap, or how can this help us move forward, right, with water infrastructure in terms of like providing more equitable, and if so, how do we do that? maybe the like Nikki and Lauryn and Khalid can potentially start, and then we shift to Kathleen.
Yeah, I think, Khalid, you can add on a little bit too, because he's done a lot of additional work focused on equity specifically. But I think as you were talking about with having more flexible infrastructure systems and more that can adapt to, right? We're talking about COVID today, but it's present with natural disasters, displacement, a lot of kind of uncertain operating context. And so I think it's really important to focus a little bit on how to make our infrastructure systems more flexible and resilient to these uncertain contexts. And I think a big part of that is ensuring that we're able to provide equitable and reliable services during those times. And so from more of the kind of technical perspective, it's looking at, what policies are in place. Like, are we able to adapt and change quickly? Which I think is a really important aspect, especially in, COVID or crises like this.
Yeah, and I think thinking outside the lens of a disaster or a crisis as well, when we're just thinking about water systems relative to other infrastructure systems, water systems are way behind with regards to bringing the actual infrastructure up to date. We're still using 15th century techniques in the 21st century, and some of them work. If it's working and it's not broken, don't try to fix it. But I think we're realizing now in disaster situations that actually the system does have flaws, and maybe we need to revisit those from an equitable lens.
I think it's interesting to think as you both talked, I was thinking through how infrastructure is not just the hard infrastructure of the pipes and of the actual distribution and even of the utility buildings itself, but infrastructure kind of entails this bigger picture of the policies around it and the users. And I think kind of when we think of infrastructure, and especially in light of political bills that are on the go right now and the debate about what even is infrastructure. Is it the technical, hard infrastructure? Is it the social aspects of infrastructure? I think it has all these complicating pieces around it, which makes this question so hard, but also at the same time so interesting. And I think that's something that's really key to think about as we think about Catherine's work and how design kind of plays into that.
One thing I keep seeing on Twitter, sorry, I spend a lot of time on Twitter, so no surprise that my research is relevant to using Twitter data. But one thing I keep seeing in response to a lot of political messaging is housing is infrastructure. And currently, the way that infrastructure is thought of, housing is sort of private, right? It belongs to someone. But when we think about air quality, when we think about water quality, we can fix everything up to the curb. But if everything on the other side of the curb is not up to date, or it's not doesn't provide you the best air quality or water quality, then there's still an issue, a health issue that exists there. And then a lot of that has to do with equity, because you may be buying a house that you didn't know that some of these invisible infrastructure that exists within your home that you can't visibly see are defective. And oftentimes an inspection is not going to reveal too much. And so that's where I think a lot of the push right now for housing as infrastructure is looking at how can we start looking at systems within the home and allowing people to have some resources to correct those.
Yeah, and even touching a little bit on that, I think that when you talked about housing as an infrastructure, or this notion of the hard and the soft aspect, right? I think that there is the tangible, right? The thing that it's actually built, and then there is the whole set of dynamics of daily life and how people use it, right? Which then becomes almost like the soft element of that, right? So that the connections that they're made, the relationships and the use, and primarily that soft aspect has been a result of that hard design. But now we are seeing the need to actually have that integration in the process of even framing the problem. Right, and even understanding what is it that we are designing for, what is it the problem that we are solving for, right? And I think that this is super interesting as it relates to framing infrastructure in a different way and reconceptualizing it. So you guys are bringing this notion of the social technical system, and then Catherine and the data shows of her work, this notion of socio-ecological system, right? And understanding the relationship with the ecosystem in which we live in, right? From the perspective of the perception. How come we're living in a water scarcity period when I open my window and there's the Great Lake in front of me, right? So that notion, I think that really challenges some of the approaches that we've taken towards infrastructural development. And so, Catherine, do you want to comment a little bit on that and on what they're saying? Oh, you're muted.
The phrase of the year.
Still muted. There you go. Can you say something? Yes.
Yeah, sorry. I think a moderator muted me, so I couldn't unmute. Yeah, I think something really important too that came up in the initial research for this project was the importance of the knowledge flows, because people that either start out on their own or due to other inequitable systems haven't had someone in their family or friend group that had home ownership to know things about testing the water or what to do with the water shutoff. That was a big barrier to entry to even start out, to be like, oh, I can get a water pitcher, because it's that knowledge communication is not communicated unless oftentimes someone that's gone through it. So I think with a lot of these things, it starts at if it does go past the curb, how do we ensure that there's equitable access to those that are maybe doing this for the first time and don't have that historic experience with these kinds of issues?
Yeah, so the adaptation again, right? Who needs to adapt, people or the system? I have a question for you, Nikki, before we close, from Penn. The question is, what other variables apart from income will be accounting for when focusing on that on the study that you're doing?
Yeah. So that's a big part of what we're currently undergoing right now, is we're building a difference in difference model that uses, of course, an exact matching to match counties that are similar with a lot of different variables. So that includes everything from population density, demographics, income, racial backgrounds, everything from skills-based capabilities. So we have a lot of different variables that we're incorporating into that course and exact matching approach. The idea there is to find counties that are similar and then be able to understand within the states that implemented different policy approaches how varying COVID levels resulted from the differences of policy. And so can we attribute changes in COVID levels within each state, the moratoriums, based off of all these other kind of factors that we're controlling for and considering for within that model? So that's what we're doing right now, using COVID as your outcome variables. Much more complicated than we anticipated it being. So it's underway right now, and we're excited to see what the results find.
Well, I want to be respectful, even though we already been a little bit respectful of people's time because we passed 4 minutes. So I appreciate all of you from the hard work. I love this cross-university collaboration, and I think that there is so much more for us to discuss and focus and relate water to equity, to climate change, to economic challenges, and to health history, as Pam is bringing back here. So I appreciate your time, and I will see you in the next session. Thank you very much.
Thanks so much.
Thank you, everyone.
Yeah, thank you.